All right. Hello, everyone. So just to begin with a few introductions, I'm Zen. I'm the co-founder of Shadow Bunny, and I'll be your host for today, Marissa.
Hi, everyone. My name is Marissa. I'm the other co-host, co-founder of Shadow Bunny, and I'll be the co-host today.
All right. So joining us today, excuse me, is Dr. Jacqueline Watchmaker. She is a dermatologist practicing in Arizona. Would you like to introduce yourself?
Hi, everyone. I'm Jacqueline Watchmaker. And I'm a dermatologist. I trained mostly in Boston, but I recently moved to Arizona and I am practicing here. I do a mixture of both medical dermatology as well as cosmetic and laser dermatology.
All right. So just to give you all an idea of how this is going to work throughout the day. So we'll be giving this presentation, or Dr. Watchmaker will be giving this presentation. And so, sorry, let me continue sharing my screen. So yes, Dr. Watchmaker. So Dr. Watchmaker will be presenting today. And at the end of the presentation, you'll have a chance to ask questions, get some clarification on anything, or if you're just curious about stuff, you can ask her. After that, there will be a super short 10 to 15 question quiz. It's very easy. We make it very easy so that you all can have shadowing hours. So from this, you'll gain 3 shadowing hours, 2 from the presentation and 1 from just taking the quiz. So it's very easy process. The quiz and presentation will also be made available on our Instagram's link tree. You can follow us on Instagram to access that link tree @_shadowbunny. I'll be giving you a few links on our Instagram handle at the end of the presentation as well, if you'd like to see it there. You'd also be able to join our Discord and watch this presentation on YouTube. So it's recording right now, and you'd be able to watch this on YouTube. You can take the quiz right after the presentation, excuse me, right after the presentation or anytime thereafter. That's why we put it on YouTube. And yeah, we put on YouTube with the link so that you can access both the quiz and the presentation at any time you'd like, and submit the quiz. From that, you'll receive 3 shadowing hours in your email. We do these certificates manually, so it might take a little bit of time to get your certificates out, but you will get them. And if you ever have any questions or anything, you can just contact us on Instagram or email us. Our team of outreach is very, very responsive, so you will get a response as soon as possible. All right. So as the disclaimer said, you won't be able to turn your camera on or anything like that to prevent Zoom bombing, or just to keep this environment technologically safe. So yeah, you'll be allowed to unmute a bit later so that you can ask Dr. Watchmaker some questions, but that is at the end of the presentation. So now it is to Dr. Watchmaker, so you can go ahead.
Perfect. I'm excited to be here and to share with you a little bit about a day in the life of a dermatologist, and to answer any questions you might have about, being pre-med or medical school, getting in, and then residency, and then life kind of just as a doctor. We're going to go over kind of my path to medicine, some struggles, what dermatology is, some misconceptions about dermatology, just some general advice that I wish someone might have told me when I was younger. We're going to go over a few cases as well, and then there'll definitely be time for questions at the end if you have any. Next slide. So just a little bit about me to start. I have 4 siblings, 3 sisters and a brother. 4 of us are doctors. The youngest is still, too young for that. But I have a twin sister and we're the oldest. And I think once we kind of started down this path, my younger 2 sisters just saw how, it was hard, but we were enjoying it. And they similarly pursued a career in medicine. And I think, all four of us have been very happy so far. I love to travel. Recently went to Greece this past summer, which was amazing during a, downturn of COVID. In my spare time, I like to work out, go hiking, attend bar class. I'm originally from Wisconsin, but I haven't lived there since med school, but I love to go home and visit, especially in the summer. And yeah, I finished my internship and residency and fellowship out in Boston, but just about 4 months ago, I moved to Arizona with my husband, and we've been loving it so far. Next slide. So a little bit about me when I was kind of younger in the pre-med and contemplating, pursuing a field in medicine. I was always interested in the sciences. I was always, a little better at the sciences. It just came easier to me than kind of English and social studies. So I always thought I would do something in the science field. My dad is a doctor, and he loved his career, and, we saw how happy he was. So he also definitely was a positive influence on me becoming a doctor. I do, tend to like kind of efficient, fast-paced environments. And I think that's more of a reason I ended up going into dermatology. We'll kind of discuss what a day, in the dermatology clinic is like, but it is fast-paced, and you have to be kind of efficient and constantly kind of thinking and chatting and diagnosing and biopsying. So it's really fun, but it's definitely, fast-paced. Throughout kind of high school and college, I did, hold some leadership positions in different student, clubs. And I think that was very helpful when I was applying both to medical school and then residency. And I also was involved in a few different mentoring groups, both kind of receiving mentorship, but also, mentoring other students. I was involved in kind of this pipeline program in college where I was paired with a high school student and mentored them kind of in the sciences and helped them prepare for kind of their SATs. And then similarly in med school, I was involved in a similar type pipeline program. I think as far as activities and, extracurricular events, especially, in high school and college, if you're thinking about, going to medical school, I always felt a little nervous because everyone I talked to was involved in, every single activity, every single club, they were, it seemed like everyone was doing it all. And I kind of took the approach of like quality over quantity. So I like took leadership positions in the clubs I was involved in, and, really devoted time and energy into making the groups I was in, better. And I think in retrospect, that was the right approach. I think I was able to, on my interviews for medical school and residency, I was better able to, articulate my involvement in these groups and kind of my leadership skills and how I implemented them and, making certain things better. As far as education, I went to Emory University for undergrad. They have a great pre-med program, so that was great. And then I went back home to Medical College of Wisconsin for medical school. When I went into medical school, I definitely wasn't thinking dermatology. I kind of went in with an open mind, and I went through a lot of different phases of thinking. I wanted to maybe do ER, pediatrics, or orthopedic surgery, plastic surgery, and ultimately I landed on dermatology, and I am very happy. I haven't regretted it since. Then I went to a Tufts Associated Hospital for intern year. So after medical school, a lot of different specialties. Before kind of you start subspecializing in your specialty, you do 1 year of kind of general internal medicine training where you work at the hospital, you work in the ICU, you work on the general medicine floors, you have some electives in, rheumatology and infectious disease, and it kind of just makes you a good, well-rounded doctor. And I do draw, a lot of things, every day from things I learned that 1 year of internal medicine. So dermatology, radiology, ophthalmology, anesthesia, all kind of do this 1 year of, it's called intern year or internal medicine usually. And then after my 1 year intern year in internal medicine, I did a 3-year dermatology, 3-year residency at Boston Medical Center. And then after residency, I did a 1-year fellowship in kind of aesthetic and procedural dermatology out in Boston as well. You mostly in dermatology during residency focus on just, medical dermatology. You see patients that are really sick, inpatients, patients with very advanced disease. You don't really focus too much on kind of lasers and cosmetics, and I think that's right and the correct way to go about things. But I did want to kind of incorporate some of that into my practice, so that's why I did 1 additional fellowship year. Next slide. Some of the struggles of kind of going through the pre-med route and then the medical school route. For me, balancing school and life, and I think other people did a better job than me. I know, when I was studying for the MCAT, and then similarly when you study for step 1 in medical school, I kind of put everything on the back burner besides studying. I didn't work out. I hardly went to the grocery store. I lost touch with a lot of friends from college, when I was studying, my first 2 years in medical school. And I think, you don't need to do that. There's a way to balance things, and, things will fall by the wayside, because, especially medical school, the first 2 years is very intense. But for instance, my roommate did a great job. She would always work out, even if we had, a string of tests the next week. And I think she mentally was just always a little bit calmer because she did kind of make time to balance, both her life and school. I think by the 3rd year of medical school, I definitely learned how to balance that better, but it did, take me, a year or 2 to learn that. A few other struggles, just competitiveness. I think, I mentioned before how you always, it's hard not to compare yourself to other people. But I think if you, put in the time, put in the effort, if you're, kind, if you study, you don't, you never need to compare yourself to other people. And if you're doing your best, that's, all you can do. I talked a little bit about studying for step 1 and how I put the rest of my life on the back burner. But definitely in residency and when I was studying for my, dermatology boards, I had finally learned kind of how to balance life and studying better. So yeah, next slide. So is dermatology for you? I think, before even asking if dermatology is for you, you should ask yourself if you're pre-med, not in medical school yet, why you want to be a doctor. I think this is less prominent now, but, some people think, doctors make a ton of money and, they're, it's this prestigious field and, you want to make your parents proud and stuff like that. But the people who go into, medicine for the wrong reasons are ultimately the people who come out the other side jaded and unhappy and, sometimes end up, not even practicing medicine. And it's just kind of almost a waste of, 4 years and time and money. So, if you, truly want to help people, and I think if you truly are interested, in the sciences and, in anatomy and physiology, then, those are reasons to go into medicine, not money and prestige. Oh yeah, and something I love about dermatology, and one of the reasons I went into it is, people think it's just a skin, but there is such a variety, of things within the field of dermatology. From old, we treat very old patients to, newborn babies. We treat relatively, healthy patients with, minor conditions to like very, very sick patients in the ICU with, full body rashes. I like how dermatology is kind of a mixture of medicine and surgery. There's lots of hands-on procedures, but you also are prescribing lots of medications, some of which are, heavy duty medications with side effects that, you have to know how to, monitor and, prescribe correctly. So I love dermatology because no day is, like the last, and, whatever walks, I'm always kind of surprised at what walks through the door, but that's what, keeps things interesting and why I'm never bored. So next slide. So an ordinary day in medical dermatology. So I do medical dermatology 2 days a week. I see about 30 patients a day. I usually start around 8 a.m. and end around 4 or 5 p.m. Typically, the appointment times are 15 minutes. Sometimes if a patient is very complex, I'll schedule them for slightly longer, but most dermatology conditions, we see patients in 15 minutes. We kind of talked about how there's a wide range of conditions we see and ages of patients we treat, a wide range of, things we do every day. And I kind of already talked about how it's a mixture of medicine and surgery, and how I like that. So next slide. So here are just a few, common conditions that I see every day. The top picture is a picture of what's called Papillopuscular Rosacea. The side picture of the arms is a picture of plaque psoriasis, and then the bottom picture of the little dragonfly is a picture of a contact dermatitis to a henna tattoo. So next slide. And then 2 days a week, I see cosmetic patients. I see about 18 patients a day, slightly longer appointment times because a lot of times we're doing, laser procedures or cosmetic procedures on that same day. One of my favorite things to treat on my laser days are scars. Acne scars are one of my favorite things to treat just because it's so gratifying. When patients, have acne scars all over their face and, they have really low self-esteem, and then, you work with them over months and months, and then, you just see their self-esteem, increase, and their happiness, increase as their acne scars improve. Surgical scars, I treat a lot as well. And I think similarly, patients are just so happy when they see their scars improving. So a lot of times scars are, reminders of unpleasant, periods in our lives. I treat birthmarks. There's tons of different, kinds of birthmarks out there, vascular birthmarks, other kinds of birthmarks. And I think that's also very gratifying as well. I do also do kind of just more routine filler injections and Botox and overall kind of skin rejuvenation procedures as well. Next slide. So a few misconceptions about dermatology. I've heard, people say, dermatologists aren't real doctors. All we do is, topical steroids and Botox. And I think already from what I've kind of shared, you all can tell that's, not true. That's a gross simplification of our field. It's very, very diverse and can be complex. And I do think one of my favorite things about dermatology is, the impact we have on people's lives. I love how patients, for especially rashes, can see, the treatments that you discuss and prescribe to them, improving, their skin, and, each day they do it, they feel better. And I think it's, you really get to partner with your patients because patients can feel and visually see kind of the improvement. And I think that makes patients really, invested in their treatment. I think quality of life, if a patient comes in like so itchy, full body rash, and we can kind of like calm that down. I have patients who come and say they haven't slept well in like months because of a certain rash. And then, with some medications and, some, changes in their routine, we can get them sleeping well and just dramatically improve their quality of life. So that's also very gratifying. Next slide. So some advice. I think, identifying a good mentor who has time, to invest in you and, really give you, good sound advice, and, someone who isn't scared, to tell you, the truth is very important. I know, some, professors in college and even, some, doctors in med school, they're so busy and they, maybe don't have, the bandwidth to, take you on as a mentee, and don't take that personally. But I think just, finding and, one or two or three great mentors is invaluable. And I think, you know, I did that in medical school and in undergrad, and you know, sticking with someone long term so they can really write, you know, good recommendation, you know, letters of recommendation, and have, like, you know, multiple examples of, you know, how you have excelled in various parts of your, you know, education and training is essential. And taking every opportunity possible. So I think especially kind of, you know, in med school and, you know, early career physicians, like I rarely say no. That's why I'm here today. You know, I think little opportunities, however small or, you know, potentially annoying they might seem at the time, usually lead to other opportunities. And I think that's true for, you know, even little things in college, like writing small case reports, or, you know, getting involved in, you know, a research project, you know, even if, you know, it's on a very low level, you know, I can't tell you how many times like small little things I've done have then led to, you know, larger, more exciting, you know, opportunities that have like advanced, you know, my career, or, you know, or have really helped me, you know, get into, you know, other things. I think sometimes people who are pre-med, or even in medical school, or even in residency, they kind of expect to be taught everything they need to know. And I think that is a mistake. I think you need to be, you know, proactive about your learning. You need to ask questions. You need to, you know, even if you feel like you sound stupid, like have someone, you know, really explain things to you. Don't kind of take a back seat in your education. You know, being proactive, you know, never hurts anyone. And I think that is one thing that has really made me, you know, so successful, is I haven't kind of waited for other people to give me opportunities or to teach me things. I've like sought out those opportunities, and I've like taught myself things, and I've asked questions. And I think that has kind of gotten me to where I am today. Next slide. So here are a few patients, just patient examples. This first patient I saw when I was an intern, so I wasn't even doing dermatology yet. I was just kind of on the internal medicine floors in the hospital. And this patient, we diagnosed with scrofuloderma, which is a cutaneous form of tuberculosis. Tuberculosis is usually in the lungs, but sometimes it can be in the lymph nodes and come to the skin. And it's very rare, especially in the United States. So initially it was misdiagnosed and mismanaged. And I was kind of part of the team that helped correctly diagnose the patient and correctly treat the patient. And, you know, I had multiple, you know, family discussions, and, you know, I was, you know, took care of this patient long-term, and it was, you know, great to see the patient slowly start to improve. And the family was just, you know, and the patient were just both so grateful. So I think this also kind of, teaches the point, like, don't, you know, take everything at face value, like ask questions. Like if something isn't making sense, or you don't think a diagnosis fits, you know, even if you think, you know, you feel like you don't know enough to like question something, just like look it up, ask questions. And I think that, you know, can only benefit you and can only benefit the patient. So yes, next slide. And then another patient, this was from one of my first years in dermatology residency. I remember he came in covered head to toe, including his scalp all the way down to his toes, feet, palms, groin, everything, with full body psoriasis. And he hadn't left his house in months and months. And he like wasn't really showering because he didn't know, you know, what was going to hurt his skin and what would be better for his skin. And he was just, you could tell by his body language and just the tone in his voice that he felt so, you know, defeated. And also thankfully he came to us, because there are great medicines out there today that can, you know, treat psoriasis. And, you know, that first appointment, I remember walking in and, you know, I knew immediately, you know, what it was. It was very classic psoriasis, just the most, you know, severe, you know, body surface area involvement I had ever seen. And I just remember even like touching his hand and like patting him on the back and like letting him know, like, we're in this together and it's going to be okay. And we're going to make him better. Just like, I saw like even over that 15-minute appointment, like his mood, you know, shift to be more positive, you know, because I think he hadn't had like a human touch in like months and months, because I think people who, you know, you know, didn't know what it was, you know, thought it was like gross or contagious or something like that. So I, you know, just reassuring him and, you know, immediately telling him, you know, what it was and giving him, you know, words of encouragement, really, you know, changed his mood. And, you know, I saw him back just a month later and he was already dramatically improved and his whole demeanor had changed. So that was great. Next slide. And then here is just a little case to kind of walk you through something I do very commonly, probably 5 or 10 times a day when I'm seeing medical dermatology patients. So this is a 56-year-old male patient, a history of extensive sun exposure, and he noted this new bump on his leg that had been growing, and he pointed it out to me. Next slide. And I suspected this was something called a basal cell carcinoma or basal cell skin cancer. Basal cell skin cancers are the most common kind of skin cancer. I see them many times a day. And in order to kind of diagnose and treat these, or to diagnose them, you do something called a shave biopsy. You inject a little bit of numbing medicine, lidocaine, into the skin. And then you take what's called a derma blade, this blue little blade you see in the picture. You kind of just shave off the top of the lesion and you send it to the pathology lab. Next slide. Oh, and here's just a little picture showing kind of what a shave biopsy is and how to do it. Next slide. And then usually in about a week, a dermatopathologist, which is typically a specialized dermatologist or a specialized pathologist who specializes in just reading skin biopsies, will let you know the results. And this came back as a nodular basal cell carcinoma, and it has a classic histologic finding. You can see on that slide some like those, you know, blue cells that, you know, form a ball, and it kind of has some peripheral palisading along the inferior edge. That is classic and diagnostic for a basal cell carcinoma. So then when I got the results back, next slide. There's a few different treatment options, but commonly we cut these out with a little bit of normal skin margin on either side to ensure we get it all out. These skin cancers rarely spread to the lymph nodes, you know, unless they're, you know, large and fungating and have been ignored for, you know, many years. So usually just cutting out the affected area and a little bit of surrounding normal skin treats and cures the skin cancer. So you typically cut things out in an ellipse shape so that it can close nicely. So you inject the area with a little bit of numbing medicine, you cut out a small ellipse, and then you put in some stitches. Usually the top stitches are removed in about 2 weeks and the bottom stitches dissolve. And this is kind of the cure. And it's nice as a dermatologist, you get to, you know, diagnose, you know, biopsy, and then, you know, treat skin cancer all the time. Next slide. Here is another case. It is a 42-year-old female patient. She has red cheeks and she is bothered by kind of the flushing she gets, especially when she eats spicy foods or drinks some alcohol. She also has some little, sometimes painful bumps on the cheeks that bother her. So next slide. This is classic rosacea, something called Papillopuscular Rosacea. I showed a picture of it in a slide at the beginning of the talk. There's a lot of different things that you can do. For mild or moderate cases, we typically prescribe a little topical anti-inflammatory, antibiotic that can really help calm down the bumps. The flushing that this patient was concerned about can best be treated with a laser called the pulse dye laser, which specifically targets kind of red blood vessels. It uses laser light to kind of collapse down unwanted blood vessels. So we kind of use a combination of both medical therapy and laser therapy to treat this patient. And then when she comes back a month later after having, you know, a laser treatment and using the topical medication, she is much better. And I think it pictures on the next slide. And here she is, and you can tell kind of the background redness is improved and also the little bumps are improved. So she was very happy. Next slide. And I think that's it. So I'd be happy to answer any questions you have about, pre-med, medical school, residency, being a doctor, life, anything.
Oh, yes, I will allow some time to type it in the chat. I'll enable everything so you can do that. You'll also be able to unmute, type in the chat, all of it. So, go right ahead if you have any questions. All right, so someone in the chat asked, what's the most common thing people visit you for?
I would say, well, being in Arizona, lots of people have a lot of, sun damage here. So probably the most common thing would be kind of new little bumps or, just skin checks, where we check kind of the patient head to toe, all of their skin, to look for any skin cancers. So probably that is one of the more common things. Acne is also very common. I do see a lot of younger patients for that. Eczema, like it's called atopic dermatitis, that itchy rash little babies get, but also can continue into, your teenage and adult years, is another very common thing I see.
Another question that I personally have is, how would you go about getting into medical research as a high school student or pre-med?
That is a great question. As a college student, it's easier. Chatting with some of your science professors, your chemistry professor, physics, maybe less so, but biology. Usually professors, at universities have ongoing research projects that you can, help out on, either doing kind of the actual bench research or, helping to collect data, analyze data, or even write up the actual research paper. So they should be able to put you in contact with, someone who has an ongoing research project. I know as a medical student doing a lot of research, I was always looking for, interested college students who are smart, proactive, and, wanting to get involved in research. As a high school student, I think it's a little bit harder because, you're not connected with a university typically that is doing a lot of research. But I do think, reaching out to even some local universities, science professors, even just cold emailing them might, be helpful. If you do know any, physicians or friends of friends, who are, in medical school, reaching out to them can also be helpful, I think.
All right. Another question we got in the chat was, as a dermatologist, what's your personal skincare routine like?
So I like to keep things simple. I think on Instagram and TikTok, all of these like skinfluencers, or so they're so called, try and make things very complicated, and they discuss things that have, little evidence behind their efficacy. So I always tell patients you kind of need 3 or 4 main skincare products. You need a good sunscreen, first and foremost. You need, when you're a little bit older and, in your 30s, you can start using an antioxidant serum, like a vitamin C serum. So a sunscreen and antioxidant serum that I apply both of those in the morning. And then at nighttime, I apply like a retinol, so like a tretinoin or a vitamin A cream. And tretinoin, vitamin A creams can help with a lot of things. They can help with acne. They can help with unwanted pigmentation. They can help with fine lines and wrinkles, which, as a high school student, you don't need to do that. But retinol creams, vitamin A creams are, essential. And then a good moisturizer. None of these need to be, very fancy or expensive. You don't need, to be exfoliating all of the time. You don't need all these fancy toners. You don't necessarily need like a different eye cream and neck cream. I think a lot of that is kind of just marketing from skincare companies. So yeah, in the morning I apply my antioxidant serum followed by my sunscreen, and then at night I wash my face and apply my tretinoin followed by my moisturizer.
Someone asked, is niacinamide and or other chemical exfoliants actually as effective as advertised?
I think niacinamide is okay at doing a lot of things. It's a little anti-inflammatory. Can be a little moisturizing. It can help with pigment a little bit, but as like an added ingredient, in a moisturizer, I think it's totally fine. But I don't think niacinamide, the ingredient itself, is excellent at, doing any one specific thing. And there are skincare products that are kind of better at targeting, moisture and better at targeting pigment. And chemical exfoliants, a lot of times, especially if you're using like a retinol, which I think is better, you don't need to be constantly exfoliating your face. Definitely not with kind of mechanical, those beads and some, St. Ives apricot scrub is like a no. Like that's too harsh for your skin. A gentle chemical exfoliant, is fine. And most people, it's not essential though. And I think I see another question. Have you recently been involved in any research? Yeah, throughout residency, fellowship, and now as a practicing dermatologist, I've done a lot of research, mostly in residency and fellowship. Ranging from case reports to true patient outcome data. Research papers, I've written, review articles, I've written book chapters. Yeah, I've done a lot of different things. I never did too much true bench research. I was more kind of, I more liked the clinical kind of research side of things. I was, in fellowship, involved in some clinical research trials, like a microneedling, study, and some, laser studies, new lasers. So yeah, I think research is fun. It's exciting. You become an expert in whatever you're, researching, because you learn so much about it. And, then people ask you to, give lectures on those topics. So it's a fun, exciting, thing to be involved in research. It definitely takes time and, energy, especially if you want to do it well. But I've always liked being involved in research, and you get connected to, a lot of different people. I've met, so many people both in person and virtually, just from, research opportunities I've had. So.
Yeah, someone else asked, what kind of research did you do in undergrad? I know that Emory is great for medical research.
Yeah, so one of the big research studies I did in undergrad was actually, I was a dance major actually in college. I was a dance major, but I was pre-med, so I took all the pre-med classes as well. And it was this study that looked at if routine tango classes in elderly patients can kind of improve like vertigo and kind of improve their balance and strength. So I was kind of involved. I came onto the project once the project had been kind of developed, and then I was involved in doing the tango classes with the older individuals, and then kind of assessing post treatment or post the tango classes, kind of how much improvement they had. And then I was a little bit involved in analyzing the data and writing it up. So that was kind of one of the bigger things I was involved with. I know a lot of both my sisters and a lot of my friends were involved in more, bench research, doing Western blots and Northern blots and, more that kind of research. I never, did that. But yeah. And I got that opportunity just by asking, I think, like my microbiology teacher, and she knew I was, a dance major, and she, one of her colleagues was doing this project, so she connected me with her, and it really melded both of my interests. And then I did write like a little case report as well in college on an interesting patient that a doctor saw, and when I was shadowing. So I think shadowing like this, but also in person, does kind of open up opportunities. I wouldn't have written that case report, and I wouldn't have seen that patient that I wrote that case report on unless I shadowed. So that was helpful.
All right. I can give like a minute if people are still typing their questions in the chat, but yeah, the research projects seem pretty interesting. So yeah, I'll give it a minute and then we'll close off.
Okay, so seeing that no one has any more questions, we're just gonna wrap this up. But before we do that, we have attached a link tree with all our socials, including Discord, our website, and our Instagram, and also our YouTube. If you missed any part of this, it will be uploaded on our YouTube with a Google form attached. Zen is going to send that soon, and using all those socials to keep updated with like webinars and different opportunities is a really good idea.
All right, so here's our link tree. And just for some more links, our Instagram handle, our Discord link. On our Discord, we oh yes, sorry, that's the correct link. So yeah, on our Instagram, we post announcements about webinars and stuff like that. Our Discord link I'll put in there as well. We also put announcements there. You can ask questions there, and our YouTube. Cool thing about our YouTube is that you can access and take quizzes for older webinars as well. So we have lots of other specialties. If you're interested, you can take those quizzes. And yes, Dr. Watchmaker put in her Instagram, so definitely follow her. That is, oh, I pasted the wrong thing. Sorry, 1 second. All right, there it is. Okay. Yeah, so if you all don't have any more questions or anything like that, thank you so much for coming, and tell your friends. We'll see you next time. And don't forget to take that quiz.
Thanks, guys.
Thank you.
Thank you.
Stop sharing.